What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we are covering the beautiful world of X-ray of radiology. So to give you context, I do X-rays at night. I've been doing it for about 4 years. Now, the subject of today's video is what it's like working at a place, right, in a hospital, ER, trauma 3. Now, what happens when certain aspects of your departments get closed down due to maybe maintenance, due to the weather, due to maybe some shortages, maybe other technical stuff, tornadoes, different aspects of the hospital that will cause a change in day by day. So to give you some examples of what I've gone through, and if you're curious, so if there's ever a tornado in your state, in your area, depending on if it's gonna either hit your place or it's within the areas close to your, to the hospital, there's different protocols they'll take that could affect your day, you're, trying to go do x-rays. So from what I remembered, if there's a tornado, all the patients that are right next to the windows, and so while they all get moved into the hallways or they get shifted into different rooms. So if you go to the floor to do some x-rays and there's a bunch of patients outside, not in the room, you can't technically do the x-rays because of Alara and other stuff like that. Even down in the ER, certain rooms, the patients are put in the hallway outside of the windows, away from the windows. So you'll have to bring back everyone. Now let's say that there's an electrical shortage or you're dealing with other technical stuff like that. So at a hospital, majority of all the hospitals have generators, but certain parts of the generators will go off and then they'll kick back on. So depending on if your x-ray equipment is connected to the ground, to the generator plug, ours is a little red plug, it will flicker and you'll just have to reboot all your systems over, and certain aspects of the department, they'll still stay on, but when you shoot, it'll shoot blanks. So you'll still have to reboot it. Sometimes certain equipment has to do that. Same thing with all the MRIs, all the CAT scan. You'll just have to reboot the system. Ain't no problem there. I will say there will be a delay in patient care if you do go down certain routes of what's the word? Fallbacks or priorities. There's a lot of the times the lights will go down and some of the patients start freaking out, so you kind of have to talk to them, hey, we got this going on, you're gonna be okay, because sometimes the lights go off, and at certain hospitals they don't have generators, and I was a student one time and all the lights went off and it was very dark. It looked very, very scary. The whole hospital was dark. We literally had it was a trauma 4. It was a very small hospital. So they literally told everyone, hey, we're gonna have to send you home. Hey, we can only do this and that. Only the emergency room was open. They didn't really have inpatients. It was that tiny. So everyone else kind of got sent home. I was there. They sent me home because they're what can you do? We're not even doing x-rays. We're not doing anything. Only the ER's open. It was quite interesting. Let's see what else. I would say that your systems, if you're like Miguel, what is more dangerous, not having Wi-Fi or not having switching to generators? You would think that the generators would be, but the Wi-Fi, not having internet or going through software updates will kind of set back the whole hospital, and it has astounded me how much you would think generators and all that would affect it more. But the internet not having like connection, you have to go like manual mode. And if you're like maybe day shift and maybe you haven't worked at a hospital during the back in the good old days, as they call it, where you had to do charting by like chart, like manually writing everything, and what it called downtime, it could throw many people into a frenzy. I personally, it's just more work for us. We just have to manually put everything in. You can always quick start or trauma or emergency exams and just have it there local until your system boots up again, and then you can throw them back on the packs. But sometimes they don't. It doesn't come back up. You have to manually push it so the rads can read it. There's there's those kind of situations you can find yourself in. If you work night shift, you will constantly be dealing with like system updates, and it'll probably be on your shift, and you'll have to learn what to do when there's no network, or what to do when they push an update and it's either the system you use to check like your charts, and then there's the actual PACS updates. Those are like completely different. The one that affects more is like when the main system everyone uses to run their like charting and stuff, when that one goes down, then everyone feels it. But when only PACS and the X-ray department goes down, then everyone's like, hey, what's going on with X-ray? Nothing's getting read. Whatever like that. So it's a little bit different. So, yeah. And yeah, if you're still watching, I appreciate you. I'm just here educating the peeps who want to hear. Giving back to the community, because I know a lot of the times the Xray tech peeps or anyone in the radiology field, if you're curious about what happens in our field, there's not that many videos out there going on. There's not that much knowledge and stuff. It's a bunch of like stuff about nurses and stuff like that. And my lady's a nurse, so I hear all the tea and the insight of what happens in the nurse world. And I always want to give back. I feel like I have a responsibility to kind of give back, because when I was a student, there were so many times when I would go to YouTube and I would go on the internet, on the Googles, and I'd be like, oh, I wonder how it was to do this, or I wonder what it'd be like to do this. And technically, some of this knowledge is kind of gatekept behind windows, behind a paywall, if you could say, because like you have to get in debt or pay a set amount of money to get this knowledge. I mean, it cost me like $15,000 to go through my program, plus like the other core prerequisites. So like $20,000 to get all this knowledge that I have, and I will be giving you insight. And if you're just curious, I have like a repertoire of videos. You can just scroll back. Some of the early ones are not the best quality, but here are the recent ones have been doing pretty good. Up the quality, got a little microphone, and I have better quality. And I'm just educating my day by day what happens. If something happens at the hospital or something occurs to me, I'll like kind of make a little video. Of course, gotta be HIPAA, gotta like make sure you don't give out all the information, but you can kind of give out your experiences and educate the masses, because as a student, I always wondered what it would be like to be on this side, living the dream, as you could call it. And I just want to give back, I feel like if I help, I mean, I'm not that big. I like right now I have like 39 subscribers. Like I don't think, like, it's very small, but like as long as I help someone out there with this video, with the knowledge, I have to give back. And I'm just going to be honest with you. Like, I'm just giving you knowledge so you can learn, maybe be better, have a better insight what it is, and to see if this profession is right for you. I will say, as my lady is a nurse, I think I made the right choice. Because it's not I mean, it is more fulfilling being a nurse, but at what cost? It is very stressful, I would say. But I'm just here getting off on a rant. But I will continue on making the videos, regardless of how they perform. I will continue improving the quality for y'all X-ray tech peeps out there, for those futures. And I hope you find this informative, and I will continue making the videos. Yeah, it's been your boy Miguel. See you on the next one.